Medicine at Oxford and Cambridge are some of the most competitive degrees in the world. Thousands of applicants, a handful of places, and an application process that's longer and more demanding than almost any other university in the UK. In this video, we're going to take you through the entire process, from the grades you need to the UCAT and the interview. Plus, we'll discover how medicine at Oxford and Cambridge actually differ from one another. Let's get started. The first thing to understand is that medicine at Oxford and medicine at Cambridge are different courses. Both are outstanding, but they're structured differently. Both unis offer a 6-year course, 1 year longer than most UK medical schools. The first 3 years are preclinical, followed by 3 years of clinical training. But there are differences in how preclinical studies are handled. For example, the natural sciences tripos in the early years at Cambridge's course means that students can study science more broadly before specialising, compared to Oxford's more linear and focused approach. In terms of admissions, Oxford is considerably more competitive. It interviews a smaller proportion of applicants than Cambridge, meaning if you do get an interview at Oxford, you've already been selected over a majority of the pool. Success rates are also roughly 5% lower at Oxford than Cambridge, though both are still highly competitive. The A-level grade requirements for medicine are A** AA at Oxford or A** A* at Cambridge, with chemistry being mandatory alongside at least one other science subject. In practice, most successful applicants actually achieve more than this requirement, especially at Cambridge. GCSEs also matter. While there's no official minimum, a strong set of GCSEs, mostly 8s and 9s, strengthen your application, particularly at Oxford, where GCSEs are weighed more explicitly. Both universities adopted the University Clinical Aptitude Test, or the UCAT, in 2024, following the removal of the BMAT. Competitive applicants typically score at least 2,100 overall, with a band 1 in situational judgment. Neither university publishes an official cutoff though, so it is possible to succeed with a lower score in some cases. We've got a full guide to the UCAT which we'd recommend watching before you start your preparation. Work experience is expected, of course, but what Oxbridge cares about is not where you did it or how long it lasted. It's about what you learned from it. What did you observe about the doctor-patient relationship? What surprised you? What challenged your assumptions? Did you see anything that made you question whether medicine was right for you? If you can't get clinical placements, alternatives include volunteering in care homes, working with disability charities, or reading medical ethics case studies and reflecting on them. Some form of formal experience is necessary, but it doesn't have to be as impressive as shadowing a surgeon. Of course, your personal statement should always be a consideration, though bear in mind that neither Oxford or Cambridge places much of an emphasis on it during the admissions process. Work experience should be mentioned, but should not be the centrepiece. Supercurricular reading carries far more weight at Oxbridge than the list of hospital visits. If you're looking for even more guidance for the Oxbridge application process, the Big Book of Oxbridge Applications has dedicated chapters to everything you need to know. It's free to download, so check it out in the link in the description. If shortlisted, you'll be interviewed in December. This will usually be online, though some Cambridge colleges do require in-person interviews. You'll typically have at least 2 interviews, each 20 to 30 minutes. It's really important to remember that these interviews are not medical knowledge tests. Instead, you'll be presented with unfamiliar scientific problems and asked to reason through them in real time. You may also be asked ethical questions about patient consent, resource allocation, or public health. Here's your complete Oxbridge medicine checklist. Everything you need. Grades: A** AA or A** A* minimum. Chemistry is mandatory, plus 1 other science. GCSEs: strong 8s and 9s. UCAT: aim for 2,100 plus with a band 1 SJT. Personal statement: lead with academic curiosity. Work experience: reflect, don't just list. UCAS deadline: October 15th. My Cambridge application: if applying to Cambridge, this is due in late October. Interviews: December, online or in person, and expect at least 2. Offers released in January. In short, Oxford medicine is demanding, but it's achievable if you prepare properly. We hope this guide has helped you understand the journey ahead of you and made you feel prepared to make the decision about which university to apply to. Subscribe for more Oxbridge and medicine content, and remember to download the Big Book for free. Link is in the description. Good luck with your application, and see you next time.